Looks like it. I'm going to talk about postoperative nutrition. I've got a couple of things going on that I haven't done in the past. There's a lot of technology out here right now. So hopefully we're going to be okay. But, you know, I figure it's going to take a couple of these before I really get the hang of it. So we'll see. If you have any comments on it, you can check it out and make sure it's running okay. I'm trying to look in the background, but kind of surfing on Facebook and giving a talk is a little bit more than I can handle at one time. So let's just see real quick if I'm up and live. I'm also trying to broadcast this to YouTube at the same time. So there's a lot of stuff coming through our network right now. Let's see. Yep, looks like I'm live. Okay. All right, so I asked everybody to comment on what they'd like me to talk about, and the overwhelming answer was postoperative nutrition, which really didn't surprise me because that, I think, is where most people need the most help that they can get, and it also really is probably the area where we can get the most benefit from changing. You know, there's other components that I talk about in terms of enhancing your postoperative weight loss, like exercise and medications, but hands down, nutrition is where you get the best results from. So I'm going to start this talk just reminding everybody about the different stages of life after weight loss surgery. Obviously, we're talking about postoperative nutrition, so we're not talking about preparing for surgery. We're also really not talking about recovering from surgery. We're going to start talking really more toward the second half of the honeymoon. And it's during this honeymoon period where we transition from a protein-first approach, which I really believe is important in those first few months. And it can be anywhere from 6, 9 months, a year. It really depends from person to person, and is something that I work with each patient individually on to kind of identify, all right, I think we've kind of hit the point where eating more protein is not going to help you, and we should really transition to a produce-first approach. And this is a tricky point, but it's going to happen somewhere halfway through or 2/3 of the way through the honeymoon years. And then on, obviously, into the end of the honeymoon years when the surgery just doesn't seem to work the way most people think. Most people think it's an anatomic problem, like their stomach stretched out, but it really is not that. It's just the natural state of the surgery. And then finally, battling weight regain. I'm just going to check real quick and see. I don't know if I can see comments. So I'm going to check real quick and just make sure I'm not missing any. Let's see. So there's never going to be a time that is better for you to make changes in your diet than those honeymoon years. And this is a diagram that anybody who's read my book or watched any of my videos is familiar with. And what it acknowledges is that if you start out after surgery at, say, 250 pounds, and the surgery is essentially driving, let's say, 100 pounds of weight loss, so that your postoperative weight will end up being 150 pounds, that period of time when you're transitioning from 250 to 150 pounds is really driven by these positive hormonal states that decrease your hunger and increase your metabolism. And it's those positive hormonal states that really are going to give you some amazing feedback. I just wrote a blog article on these hormonal states and how they can help you make the right changes, and how they give you really good advice about what foods you should be eating. So we're going to look at this time in your life as the best time for you to figure out what to eat. Now, one thing that I tell patients is that change is a must. And this period in that first year to 2 years after surgery is without question the easiest time that you're ever going to have to make a transition. And that transition really should be toward the metabolic reset diet. And I tailor this approach during those honeymoon years to add some extra protein in those first 6 months or so, because that really helps with your postoperative recovery. And it's always kind of tricky to talk to patients about the fact that, well, yeah, protein's super important right now, but at some point we're going to transition away from that. And it's critical that you understand that during that period of rapid weight loss, you do need a decent amount of protein, and oftentimes the best and most effective way to get that is animal protein. But this is really a temporary stage of your life and not something that needs to be done over the long run. So I use the metabolic reset diet, which I've written about in my book, and I have a series of videos on the website, poundtocureweightloss.com. And that is our baseline, but then we also enhance it with additional animal protein. So food addictions are something that are really, really tricky. And again, these honeymoon years when you've got this great hormonal state going on is critical for managing and addressing food addictions. And this, I think, is really the most important part of recognizing what happens with food addiction. So food addictions really are habits. And these habits will trigger, are set by a trigger, and that can be anything from coming home from work, from feeling stressed out or feeling sad, having a fight with a loved one, being annoyed by your kids, or really just sitting down on a couch and watching TV. But oftentimes there's a trigger, and that trigger initiates a behavior. And because of those thoughts or ideas or whatever's happening in your environment at the time, we are driven toward a certain behavior. And with food addictions, it's to eat typically processed foods. And then after the food addiction is the reward. And what happens in that first year after surgery is that this reward component is blocked. And when you eat food, you don't get that same level of pleasure that you had in the past, because your hormonal state, the ghrelin, the leptin, all of these things that change so favorably immediately after following the surgery really don't allow for food to trigger the positive responses in your brain that they normally do. And anybody who's had weight loss surgery can attest to this. Food just doesn't taste as good in that first year. Eventually your taste will return and you'll have some ability to enjoy food, but in that first year it just isn't a big deal to you. And when you block that reward, that's that opportunity for you to pause, take a breath, and say, hey, I have some addictions, and those addictions are something that I must manage if I'm going to be successful in the long term. And this is the perfect opportunity to do this. So the key also to food addictions is abstinence. We also see in the postoperative period a changing appetite. And that changing appetite was going to allow you to eat more every month. And this often freaks people out, but it really doesn't need to. It's not a sign of impending failure. The key is really to focus on eating food that doesn't cause weight gain. A bigger appetite means more fruit, vegetables, nuts, seeds, and beans. And so this is really an opportunity, if you need to, eat more. So you eat more of these foods as you kind of progress through the honeymoon years and are able to eat more, as long as you eat foods that don't cause weight gain. And there are foods that don't cause weight gain. And that's really the backbone of the Pound to Cure program, is focusing on eating foods that you can really eat as much of as you like and will not gain weight. So another topic that is often really important for patients to discuss and learn about is this idea of the portion control trap. So the portion control trap really is when you overly rely on restriction, meaning those first few months after surgery, it can be hard to eat a lot of food. And so when you overly rely on restriction in those first few years as a primary means of nutritional change, and you say, well, I'm not eating anything different, I just eat a lot less of certain foods. That, as a long-term plan, generally is a setup for failure. And eating less of the same foods you were eating before surgery as really the only substantial nutritional change is not our long-term goal. Over time, your ability to eat is going to increase. And so you'll start eating larger and larger amounts of the same types of foods. So an example of that is pizza. So a lot of patients will tell me, and they'll say, I had 6 months ago, I had a few bites, I could eat a few bites of surgery. It's 6 months after surgery. And at a year after surgery, I could eat a full half of a piece of pizza. At 2 years, I could eat one regular sized piece of pizza. 3 years, 2 pieces of pizza. 5 years after surgery, 3 to 4 pieces of pizza. My stomach must have stretched out. But really, that's not what's happening here. What's happening is that you've reestablished some of the old food addictions and preferences. You've relied on restriction, which is without question going to fail over the long run. So we have some comments. I plugged it in so the comments can come up. And I said, I had my sleeve surgery here by Dr. Welly back on July 9th, 2014. And that's from Lisa. Lisa, if you want to come in, we're accepting appointments. I'm happy if, no matter where you are, if you just feel like you need some nutritional labs checked, if you haven't reached your goal weight, we've got a lot of options. We're really expanding our nutritional services to include non-surgical weight loss, which really would also apply for any post-operative patient who isn't at their goal. Remember, I'm in Tucson, Arizona now. I moved away from Detroit a couple weeks ago. That's been quite a transition. So anyway, if you'd like to come in for an appointment, feel free, and we can talk about what we can do to help you meet your goals. Let's see. Okay. All right, there we go. Had my sleeve back by your videos on YouTube help me to add more vegetables and fruits to my diet. I feel less bloated and more energized on 9 months post-sleeve. And I really think that's such an important thing to do with your diet after surgery. And it's so tricky because all of our energy is focused in those first few months after surgery. And during those months, appropriately so, surgeons are telling you, you gotta eat your protein. And during that period of rapid weight loss, yeah, you must eat your protein. But that strategy over the long run is really not the best strategy. Success over the long run depends on changing the quality of your diet. And it's not just about eating less. In fact, eating less is going to change over the years. And anyone, here's someone who had a sleeve almost 5 years ago. I can guarantee you that Lisa's eating more now than she did 3 months after surgery. That's normal. That's not a sign that things have stretched out or broken down. That's just what happens. So I really encourage patients, again, to focus on the metabolic reset diet. I've got a smartphone app called Caloratio that measures the quality of your diet, not just the number of calories you consume. And I think that has to be a really important thing. So I also really challenge patients to set some nutritional goals. And number one is meet your protein goals in that first year or so. Again, up until that point when we transition from protein first to produce first. So Lisa's now commenting that she's living in Florida and doing really good. She stays away from all white flour products and sugar. She eats protein, veggies, and fruit. That's a fantastic way to eat. And I think when we talk about protein, it's always really important to think about not just animal protein like chicken and fish and eggs and dairy, but really even more importantly, beans and even nuts for vegetable-based protein, which makes a great addition to your protein. And I try to get my patients to eat about half of their protein from animals and half from plants. You don't have to be a vegan. I'm not a vegan. But I think we all should work toward eating less animal protein and not look at that as kind of the backbone of a good diet. Oh, hey, Carrie left. How are you? Good to see you. Number of days without processed food is also a great thing for people to focus on in terms of setting a goal, like how long can you go without eating processed foods. Again, the smartphone app CaloRatio, set a score for yourself. If you're scoring over 90% good calories using that app, you are eating really, really clean. That is not an easy thing to achieve, and anybody, I think, who thinks they're eating well may want to pull out that app. I think for doing it every single day gets a little rigorous, but just as a test every now and then to say, hey, am I really on track? If you think you're eating really well, great, but pull out that app and see. You might not be eating quite as well as you think you are. And I think all of us, none of us eat as well, including myself, eat as well as we think we do. I also like patients to eat new recipes and to stop counting calories and really, again, focus on the quality of the diet. So let's talk about something that is really often a challenge, is to work with patients on protein shakes. So these things in the first few months after surgery are absolutely mission critical. These are what you must be drinking after surgery if you're going to get to the right amount of protein to keep your hair from falling out and to keep the fatigue from settling in and to keep some of these symptoms that are unfortunate in those first few months after surgery. If you get adequate protein, usually you can prevent them. But we have to remember that protein shakes are heavily processed, artificially flavored, artificially sweetened, and loaded with animal protein. And so as a long-term plan, a long-term dietary component, I really encourage people to look for other healthier sources of protein. And while these are super convenient and relatively inexpensive, and really, for the most part, often are pretty, they taste pretty good, they're not the type of food that I want people eating over the long run. I like people to make homemade protein shakes. You can get 20 to 30 grams of protein, add some Greek yogurt, green leafy vegetables like spinach, some fruit, some nuts or seeds. They're not artificially flavored or sweetened. And yogurt is an animal protein, but there's this probiotic component in them, which really, to me, to some degree, yogurt is it has some benefits that other animal proteins don't have. And so I kind of think it's kind of half vegetable, half animal protein. Why do we drink protein shakes? What's the beauty of them? They're a really convenient way to go on a low-calorie diet. So a lot of times we'll put patients on a pre-op diet before surgery. I do that selectively. And they're the best way to meet your protein requirements after surgery. But I think if you're not really targeting one of these two items, it's not going to be the best option for you. Do they cause weight loss? I think this is something that's really misunderstood. Drinking protein shakes does not cause weight loss. Again, they're heavily processed, artificially flavored, artificially sweetened, and loaded with animal protein. They're designed for people who have a difficult time getting enough protein. And if that's not your problem, if you're not struggling with starvation, then this is not a necessary component of your diet. So I like patients to work toward eliminating artificial sweeteners and artificial flavors. Initially, we supplement with protein shakes, but over the long run, they're not really necessary. Once you feel comfortable that you can meet your protein requirements, and certainly once you transition from protein first to produce first, then we can do this. So when do we transition? So we do it. We make a clinical decision about that. We make that decision based on the amount of hunger you have. When the hunger really starts to return, that can sometimes be a sign that it's time to transition from a produce first approach. Depending on the amount of weight you've lost, if you've kind of hit your weight loss plateau, that's a good time to do it. Your gender, men tend to hit that point earlier than women. And then I sometimes will use a blood test, a pre-albumin protein test, to measure, and I think that can sometimes also be a clue. So Carrie Leff loves rice, cauliflower, frozen zucchini, or squash instead of ice and shakes. She uses a protein powder called Nuzest that is plant-based. Yeah, so there's some really good protein powders that are plant-based. There's some peanut-based ones. That's my guess is that's what that is. I don't know. That's the NU is for nuts. Pea protein is without question the most common one. I think we have to be very careful with soy protein. So soy is a plant-based protein, but it has a lot of these pro-estrogen effects and it may not be the best protein source. So I like the pea protein. I don't like the taste of it, but I like the idea of it. And I like the nut-based protein like PB2 powder. That's also, I think if we're going to have to choose a protein powder, those are the ones to choose for sure. This to me also is something that's really important. Now it's not critical that you go all the way to and eat only these foods on this side of the spectrum. But it's really important that you recognize that there's some foods that actually cause weight loss, and that's all of these foods on this side of the spectrum. And then there's some foods that cause weight gain, and that's all the foods on this side of the spectrum. So we really want to try to minimize corn and potatoes, breads and grains, cheese and milk, animal protein, sugar-sweetened beverages, junk food and sweets. Generally, most people understand that, but at the same time, we also want to increase our intake of these foods. Vegetables, fruit, nuts and seeds, beans, colorful starchy vegetables, yogurt. This is really a great thing for us to be eating as much of as we can. So, our nutritionist here at Tucson Bariatric, Suzette, I think said something that was incredibly wise about how to work with patients toward in improving their diet. It's that you have to meet patients where they're at. And all of us eat somewhere on this spectrum. And we may also bounce around. December we're kind of out here, January we're out here. But our diet varies anywhere from a totally processed diet to a vegan, or even some people do this raw vegan diet. And our goal is to figure out wherever you are. If you're a meat and potatoes eater, maybe moving you down toward this low carb or low calorie diet is a good move. If you're focusing on a low cal or low carb diet but eating a lot of processed food and eating a lot of animal protein, maybe we can get you more toward a plant-based clean eating diet. If you're eating clean, we can take that a step further and get you moving toward the metabolic reset diet. And if you're already kind of eating along the metabolic reset diet and are up for it, you can even consider veganism. But all of us are somewhere on this spectrum, and our goal really, especially after surgery, is to at least move down one notch. Again, if you haven't changed the way you eat, then you really haven't set yourself up to take the most advantage that you can after the surgery. So I think in summary, as we reach the end of the half hour, unless there's any questions that come up, good nutrition's a lifetime endeavor, and moving along your nutritional spectrum is really, really important. Whatever you do, you have to eat better than you did before surgery. If you find yourself eating the same way you did before surgery, you got to check yourself, because you're setting yourself up for weight regain. You can move slowly or quickly along this spectrum in terms of improving how you eat. But postoperatively, if your nutrition really has to improve, or you're at serious risk for weight regain. So I'm just going to kind of check, and unless there's any additional questions, I'm going to check the YouTube feed and see if there was any questions there. I don't even know if this actually got posted on YouTube. We'll see in just a second. But looks like we're live now, and if there's any questions, let me see if there's any questions on this. Doesn't look like it. Let's see, got 24 people watching. All right, so it was a pleasure, and we'll try to do this again in another week or so. And until then, I wish you the best and hope you eat really well this week. Again, I'm in Tucson now, and if you're interested in coming in for an appointment for any reason related to your weight, we're accepting new patients. Thanks.